I think we have a rapid development in melanoma. Over the last years, we had only very few agents to treat melanoma. Now, landscape has changed. What is the most impressive thing you have seen over the last 3 years?
Over the last 3 years, we've seen two big developments. One in oncoimmunology and one in mutation-driven drug development, so a couple of targeted agents. What we have seen here in Amsterdam right now has been a number of updates on the maturating data now, and now we have really mature data on the impact of the first approved agent in the oncoimmunology field, which is ipilimumab, in melanoma. So there's been a number of updates on clinical trials data as well as on the expanded access programs. And I think there's a lot to be learned actually from those data.
Indeed, we have treated patients with ipilimumab for almost 15 years now. We have long-term survival data of patients treated inside this early access program as well as the clinical trials. What do you think is the value of long-term survival?
Well, the value of the data is the confirmation that was of what was suspected to be the case when we had the first randomized trial data, that there was a clear tail to the curves in terms of survival, which provided a survival benefit that roughly doubled, if not more, survival in long term for metastatic melanoma patients. So if you remember that in second line, because that was the first trial, it was shown that at 3 years in that trial, but that was still very unstable data, very few patients were at 3 years follow-up. There was a roughly 22% survival rate, whereas in the peptide alone arm in that particular second line trial, the overall survival rate had dropped below 10%. So roughly what we saw coming was a doubling of survival at 3 years. And the few patients that were already out beyond 3 years didn't show any events at that point in time. What the new data show is on large numbers of patients, when you put all the phase 3 trial data and the 400 or 500 phase 2 data that were all in the package of submission at the time, you have a substantial numbers now who have been followed for 3 years, 5 years, 7 years, all the way up to 10 years. And that you see a stable curve at 3 years, 5 years, 7 years. There's almost no drop-off anymore. And so that roughly you can say that patients who have been treated within trial context with ipilimumab have a 3, 5, 7 year survival rate of around 20%. And we all know from a ton of curves on the DTIC and polychemotherapy experience that that was always below 10% with those type of agents. So this is very substantial.